This is our change project for the leadership. For our topic, we did falls within the healthcare setting. This was done by me, Corbin Gilmer.
And me, Dylan Traub Jensen.
Introduction. Falls are a significant concern in hospital settings, particularly in med-surg units, with a patient-to-nurse ratio to be seen as 5:1. These incidents can result in serious injuries, prolonged hospital stays, and increased healthcare costs. The high demands of nurses in these environments further increases the risks of patient falls due to limited supervision and assistance. By recognizing the prevalence and impact of falls, we can implement effective prevention strategies to help enhance patient safety. The purpose of this presentation is to create a fall prevention plan using Lewin's change theory, which provides a systemic approach to identifying the need for change, implementing interventions, and ensuring long-term adherence to best practices. What is the problem? One of the most common issues contributing to falls in hospitals is the high patient-to-nurse ratio, which limits the ability of staff to provide continuous monitoring and immediate assistance. Several risk factors increase the likelihood of falls, including patient confusion or delirium, medication side effects such as dizziness or drowsiness, environmental hazards like poor lighting and slippery floors, and the lack of improper use of assistive devices. Our image here shows that every additional patient per nurse above safe staffing ratios increases the mortality rate of all patients by 7%. Change theory. Lewin's change theory serves as an ideal framework for implementing fall prevention strategies in a hospital setting. This theory consists of three distinct phases. The first, unfreeze, the second, change, and the third is refreeze. The unfreeze phase involves recognizing the problem, collecting data, and creating awareness among healthcare staff about the need for change. The change phase focuses on introducing and implementing effective interventions to reduce falls. Lastly, the third phase, the refreeze phase, solidifies these changes by integrating them into daily practice and ensuring long-term adherence. This structured approach allows for the systemic adoption of evidence-based practices to improve patient safety outcomes. Unfreeze, recognizing the need for change. The first step in Lewin's unchanged theory is the unfreeze phase, which involves identifying the need for change and creating a sense of urgency among staff. This was shown according to a study that we found, which states that each year, roughly 700,000 to 1 million patient falls occur in U.S. hospitals, resulting in around 250,000 injuries and cause up to 11,000 deaths. Educational sessions should be provided to staff, highlighting the negative impact of falls and the benefits of implementing prevention strategies. By raising awareness and emphasizing the importance of patient safety, this phase sets the foundation for successful change implementation. Change. Implementing interventions. During the change phase, evidence-based interventions are introduced to prevent falls and promote patient safety. Effective strategies include implementing hourly rounding to check on high-risk patients, utilizing bed and chair alarms to alert staff of patient movement, and placing clear signage to indicate fall risk status. Patients should be provided with proper non-slip socks and assistive devices, while education should be given to both patients and families on fall prevention techniques. Additionally, increasing staffing support, such as assigning sitters for high-risk patients, can significantly reduce fall occurrences. Since, as stated by another study we found, Up to 80% of falls occur when patients are not observed. These interventions must be consistently applied to ensure their effectiveness in reducing falls.
Refreeze, making the change permanent. To continue the improvements introduced in the change phase, the refreeze phase ensures that fall prevention strategies become a prominent part of hospital protocols. Integrating these interventions into standard nursing practice helps establish consistency and accountability. Periodic training and refresher courses should be held to reinforce best practices among staff. Implementing a fall audit system allows for ongoing monitoring and assessment of fall rates, ensuring that the progress is maintained. Recognizing and rewarding staff for their commitment to fall prevention further encourages adherence to safety protocols. Continuous feedback from staff and patients fosters a culture of safety and supports the long-term success of fall prevention efforts. Evaluation methods. To measure the effectiveness of fall prevention strategies, an evaluation plan should be implemented. Success can be found by monitoring reductions in fall rates over a set period and evaluating nurse and patient compliance with the fall prevention measures. Patient satisfaction of care surveys can provide a valuable look into their perception of safety and the effectiveness of the interventions. Staff feedback could also be collected to identify any challenges or areas for improvement. By consistently reviewing and analyzing these factors, simple adjustments can be made to improve the effectiveness of fall prevention strategies. Timeline for implementation. A timeline ensures the implementation of the proposed fall prevention strategies in weeks 1 to 2, baseline data will be collected. Weeks 3 to 6 will focus on implementing the proposed interventions, including staff training and patient education. During weeks 7 to 8, an initial evaluation will be conducted to assess the effectiveness of the interventions and make adjustments if needed. Finally, in weeks 9 to 10, successful strategies will be permanently integrated into hospital protocols. This structured approach ensures a smooth transition from planning to execution, leading to lasting change and better patient outcomes. Challenges and solutions. Implementing change in a hospital setting can present several hurdles, including resistance to change, limited staffing resources, and difficulties in maintaining adherence to new protocols. To address resistance, staff should be actively involved in decision making and provided with clear explanations of the benefits of fall prevention intervention. Leadership support and continuous education can help reinforce the importance of these interventions. By incorporating fall prevention measures such as bed alarms into the daily workflow, adherence can be achieved, ensuring long-term success. Conclusion. Falls in hospitals are a preventable yet reoccurring issue that requires an evidence-based approach. By applying Lewin's change theory, healthcare facilities can identify, implement, and sustain fall prevention strategies. Through continuous monitoring, staff engagement, and reinforcement of best practices, hospitals can and will create a safer environment for patients. Preventing falls today not only improves patient outcomes, but also raises the overall quality of health care given. A commitment to patient safety and consistent improvement will ensure that these strategies remain effective in reducing falls within the hospital. Here's our sources. They're all cited. A couple of them are quoted. And then our authorship, slides 2 to 6 were done by Corbin Gilmer, and slides 7 to 11 were done by myself, Dylan Chubb Jensen, and the presentation was done collaboratively.
Thank you for listening to our presentation.